Hello, good morning, doctors. My name is Angelia Ephraim Horas with the last digit number 055. So today, a small group discussion B10 will talk about Japanese encephalitis. So this is our members.
Good morning, good afternoon. My name is Alexandra Cahyaputri Windarto with my three last digits 112. Today I'll be presenting regarding the background of Japanese encephalitis. So Japanese encephalitis is a neurological infection caused by the GEV or the Japanese encephalitis virus. It shares the same genus as the mosquito-borne flavivirus with dengue, West Nile, and also yellow fever. It is also responsible to be the most common viral encephalitis in Asia, causing 68,000 cases per year, with 20,000 cases of deaths per year too. And also, most cases of GE is actually asymptomatic. However, it has a case fatality rate of 30% and may cause sequelae up to 50% of patients. Vaccines, along with surveillance, is identified as the most common and also most effective measure to prevent GE because there is a lack of definitive treatment such as antivirus. And currently, there are four classes of vaccines available, which are the inactivated mouse brain-derived vaccines, inactivated viral cell-derived vaccines, and live attenuated vaccines, and also live recombinant or chimeric vaccines. And currently, there are various research that has been found regarding these newer GA vaccines. However, whether these researches is methodologically valid, bears a clinically or statistically important result and applicable for clinical practice remain unclear. So therefore, the urgency of critical appraisal regarding the immunogenicity and safety of these vaccines is incredibly important as a way to reduce GE incidence globally.
Okay, my name is Angela Ephraim Horas with the last digit number 055. So I will continue the student project presentation by mentioning about problem formulation. The first one is what is the questions formulation for the immunogenicity and safety of currently available Japanese encephalitis vaccine in adult or in children. The second one is what is the best evidence or journal search for the immunogenicity and safety for currently available Japanese encephalitis vaccine in adult or in children. And the last is what is the critical appraisal and application of value-based medicine for the immunogenicity and safety of currently available Japanese encephalitis vaccine in adult or in children. So there are three writing proposals in this student project. The first one is to understand the questions formulation for immunogenicity and safety of currently available Japanese encephalitis vaccine in adult or children. The second one is to know the best evidence or journal search for immunogenicity and safety for currently available Japanese encephalitis vaccine in adult or in children. The last one is to be able to complete a critical appraisal and apply value-based medicine for the immunogenicity and safety of currently available Japanese encephalitis vaccine in adults or children. Maybe that's all from me. This presentation will continue by my friends. Thank you.
Okay, my name is Samagung Radumitra Prawangsa, student number 200251193. I would like to continue the presentation explaining about the benefits of the student project. So the benefits of writing this paper serves as a practice for medical students is to form the ability on creating a structure and well-written critical appraisal, as well as gaining knowledge regarding the topic immunogenicity and safety of the current available Japanese encephalitis vaccines in adult or in children. The paper also emphasized student understanding on how to build a question formulation, clinical research question, journal searching, critical appraisal, and application of value-based medicine in terms of evidence-based medicine. In addition, these papers benefit as a reference for future critical appraisal on the topic of Japanese encephalitis intervention and vaccination. Maybe that's all from me. Thank you.
Okay, so thank you for the opportunity. My name is Amanus Panandipalsana with real estate number 115, and I will explain about how to identify the type of question. So, previously, we are given the questions about Japanese encephalitis or GE. Food. Japanese encephalitis or GE, caused by mosquito-borne flavivirus, is one of the leading causes of viral encephalitis in Asia. A number of GE vaccines have been used for preventing GE around the world. We want to know the immunogenicity and safety of current available GE vaccines in adults or in children. So, based on the scenario mentioned before, there is some information that may help to identify the type of question. Regarding the types of research questions itself are generally classified into two types, which is background and foreground questions. The scenario itself has provided the general knowledge of Japanese encephalitis, in which the general knowledge itself is usually asked in background question types. So the question itself is not considered as background questions type. But afterwards, the researchers in the scenario want the information about the safety and immunogenicity of current GE vaccines in adults or in children, which they are asking about the specific knowledge about certain clinical action. This type of information is usually asked in foreground questions types. So the questions is considered as the foreground question type. That's all from me. Next one will be presented by my friend.
Okay, my name is Ananda Karaharja with last three digits of student numbers 136, and I will continue to the PICO. So the PICO is an acronym that stands for Population, Intervention, Comparison, and Outcome. The population in this case is adult or children who have received GE vaccines, and the intervention is currently available GE vaccine. The comparison is other GE vaccines, and the outcomes is immunogenicity, including anti-GE antibody, and safety, including adverse effect or complication of GE vaccine. Maybe that's all from me. The next slide will be continued by my friend. Thank you.
Hello, my name is Agung Chewadantan. Now we are going to develop clinical research questions based on PICO. We want to ask about the immunogenicity. This time I will develop clinical research questions about the currently available vaccines. It is provides higher GE antibody than any other GE vaccine. And the second one is, does the currently available vaccines resulting in less incidence of yellow fever than any other GE vaccines? Since it is really necessary for us to know how does this vaccine is effective in reducing the incidence of yellow fever. And then safety, we want to ask, does currently available vaccines in Asian adult and children causing less adverse effects than any other GE vaccines? That's it from me. Thank you.
Hello everyone, my name is Angela Cynthia Caroline and the last three digits of my student ID number is 068. Now I would like to tell you about the journal that we chose for this student project. In the student project, we have searched using PubMed Advanced Search. We found 34 articles about the study of GE vaccines, immunogenicity, and safety. So we use the Boolean search method. The keywords are Japanese encephalitis vaccine and immunogenicity and safety or adverse event or adverse effect or complication, and we filter the journal so it will be displayed only from the last 5 years. For this student project critical appraisal, we use the article named Comparison of Immunogenicity and Safety of Licensed Japanese Encephalitis Vaccines. It is a systematic review and network meta-analysis and was published in 2021. That's all from me. The next will be presented by my friend. Thank you.
Hello everyone, my name is Amanda Raisa Suryananda with a student number of 2002-411-237. Continuing my friend's presentation, so about this journal, they conducted a systematic review and network meta-analysis on a bunch of randomized controlled trials regarding immunogenicity and safety characteristic on various vaccination in Japanese encephalitis vaccines. So these findings confirm that the newer vaccine classes are more immunogenic and have a better safety than older inactivated mouse brain-derived vaccines. Therefore, it was suggested that when available, this newer vaccine should be the first choice among the newer vaccine classes. So that's all from me. The next presentation will be continuing by my friend. Thank you.
My name is Anastasia Gunat Roslin with my last three digits Sudani number 09. I'm going to explain about it's unlikely that important relevant studies were missed in this paper. Yes, what is best? The starting point for a comprehensive search for oral relevant studies is the major bibliographic databases, for example, Medline, Cochrane, Embase, etc. But to also include a search of reference lists from relevant studies and contact with experts, particularly to inquire about unpublished studies. The search should not be limited to English language only. The search strategy should include both match terms and text words. Where do I find the information? The methods section should describe the search strategy, including the term used in some detail. The results section will outline the number of titles and abstracts reviewed, the number of full text studies retrieved, and the number of studies excluded together with the reasons for exclusion. This information may be presented in a figure or flowchart. The eligible studies were extracted from PubMed, Embase, and Cochrane Central Register of Controlled Trials or Central. With meticulous search strategy was used: Japanese, encephalitis, or vaccines, or immunogenicity, and randomized controlled trial. The study presented methodology along with the process of data extraction had been recorded to PRISMA reporting guidelines.
Hello, my name is Anet Malinda. I will explain about the critical appraisal for this study. So the critical appraisal for this study was conducted using CIBM and Oxford appraising tool. The article clearly states that the study was conducted to address problem on whether or not GI vaccines are safe and causing minimal side effect. Using better analyzed through meta-analysis, this statement was founded from the abstract and the introductory part of the article. That's all from me. The next one will be explained by my friend. Thank you.
Hello, my name is Adifa Bunam Pratama, and I'm going to continue about the last slide about the critical appraisal for this study. The study did mention criteria to include eligible study to be extracted, and all study design were randomized control trial or RCT that compare human immunogenicity and safety profile of the vaccination with placebo. Healthy children and adults with no prior GE vaccination were included in the studies. This review included studies analyzing various types of GE vaccines, such as live attenuated, chimeric, vero, and mouse brain-derived vaccine. Next slide, please. Okay, so Cochrane risk of bias assessment tool was used to evaluate eligibility and validity in each study. The quality scores were also evaluated using quality effects model to sensitivity analysis. I think that's all from me. The next presentation will be continued by my friends. Thank you.
Okay, my name is Sally Arini, and I'm going to continue to explain about the presentation. Okay, this critical appraisal part is to determine whether the study is homogeneous or heterogeneous based on the result of the study, each individual studies. It should be found in the result section of this meta-analysis. And because this meta-analysis is a network meta-analysis, so they conducted the analysis toward the inconsistency across the treatment across each individual with each outconsistency across the result, with the H equals 1 for seroconversion outcomes, H equal 1.9 for the after effect outcomes, and H equal 1.3 for severe adverse effects. And this also stated that there was little inconsistency or cross direct and indirect effects for H below 3.0 for each of the vaccine comparison in pairs. Thus, the study stated that they had found any heterogeneity or inconsistency along the literature analysis. Okay, next presentation. Talking about does the study is important or applied? That the result is applicable. Okay, we can determine it, whether it's important or not by the result of the study, which is from these outcomes from the immunogenicity after effect and severe after effect. The outcomes on immunogenicity say that the difference was statistically significant, and we can see that how the odds ratio shows 2.98 for the first for the live primary vaccines, and you can see that the confidence intervals is 1 until 8.965 for the fair cells and 7 until 20.32 for the live primary vaccines. For severe after effects, they have examined and received that only 1% severe after effect, and there was no difference in odds of severe after effect to the vaccine classes and placebo for each or every type of outcomes, the odds of effects was 2.3 times higher with inactivated mouse brain-derived vaccine compared to placebo. So this means that the results are important as it shows in statistically meaningful results from the odds ratio and 95% confidence intervals. And thus this applicable? Yes, this is applicable because the validation questionnaire was mostly in yes invalid either for data. That's all for me. Thank you.
My name is Alamanda Chandra with 3-digit student ID number 086. And here are the conclusion of our paper. Japanese encephalitis is the most common viral encephalitis in Asia, causing 68,000 cases and 2,400 deaths annually. This paper aims to understand the immunogenicity and safety of the currently available Japanese encephalitis vaccines in adults and children. A systematic review and network meta-analysis of 34 articles found that newer vaccine classes such as live chimeric and inactivated viral cell vaccine have better immunogenicity and a superior safety profiles compared to older inactivated mouse brain-derived vaccines. The World Health Organization (WHO) advocates for the inclusion of the Japanese encephalitis vaccine in national immunization schedule across the regions where Japanese encephalitis poses a public health threat. The study emphasized students' understanding of the question formulation, clinical research question, journal searching, critical appraisal, and application of value-based medicine in terms of evidence-based medicine. Thank you.